Weekly.
The Ed Resource Center reported 6.1% of American children are being treated for attention deficit hyperactivity disorder with medication. Tonight, News 13 continues our special report of ADHD Awareness Month. News 13's Jessica Ayers tells us the different ways parents can help manage their child's symptoms.
It's probably one of the most controversial topics surrounding ADHD in children: medication. Rita Olick, ADHD mom of 4, says her 7-year-old twins take daily stimulants.
Mornings are very difficult because they have not had any medication yet.
After confirming that my son had the disorder, I had a decision to make: to medicate or not to medicate.
What we think is in kids with ADHD that there are actually deficits in dopamine within the brain. And dopamine is one of the neurotransmitters that help us control behavior. If you have less of that active within the brain, you're going to be less able to kind of control.
There are quite a few medications to choose from, but most people opt for one of two: Adderall or Ritalin. Both are stimulants.
With ADHD or stimulant medications, they boost that level of dopamine.
I resisted giving my son medication for quite a while, but after a few rough weeks at school, I changed my mind. Since starting medication, my son's symptoms have improved, but it's not been a cure-all.
I love you. At this age, have to stay on top of them, and mentally it wears you out.
Sarah Pody says every child should be evaluated as an individual, and medication isn't for everyone. Also, it's important to stay in constant contact with your child's school.
Parents a lot of times have to be advocates for their kids. It takes work to make sure everyone's on the same page, the school, teacher.
John Clonch, father of 2, was diagnosed with ADHD when he was 5 years old. He was on medication until the age of 14.
I really started drinking coffee, which is also a stimulant, just like Ritalin. That started helping me focus a little bit better. And now as an adult, I still have a lot of attention issues. I mean, you can talk to my wife, she can tell you.
People can control symptoms, whether through accommodations or through medication or other approaches, but children should also be learning to be able to self-advocate.
In the beginning, I used my son's diagnosis as an excuse, but I soon realized I was only enabling him.
It's constantly teaching kids along the way that's really important.
What about diet? There is a lot of dispute surrounding food and ADHD.
When they eat a lot of sugar or drink a lot of sodas and stuff, then of course they're going to be very hyper at that point.
Sarah Pody says diet alone doesn't cause ADHD, but what's more important is sleep.
When you're tired, you'll be more cranky, less likely to kind of inhibit your behavior, and you can be a lot more inattentive and unfocused when you're really tired.
Ultimately, a parent knows their child the most, and as parents, we make the choice that we think is best. For some, that might mean medication. For others, that might mean counseling. And for most, that probably means giving extra hugs. In Panama City, Jessica Ayers, News 13, Panhandle Strong.
Goodbye.